It's time now for our weekly Healthy Living Matters segment brought to you by community medical centers. And we're continuing the conversation around stroke and stroke awareness so we're better able to identify and act when we notice the signs and symptoms of stroke.
So joining us now again is Christelle, RN Stroke Navigator at Community Regional Medical Center. And today we're talking about, and this is such a scary thing to talk about, but we need to know, and we need to know what to do if we think that our children or our child is having a stroke. So how often do you actually see this?
I have not seen it very much personally.
Well, that's good.
Yeah.
That's actually good. Not to say that, you know, it'll never happen and we should be ready. So what do we do if we think that there is a pediatric stroke or that we're seeing somebody have one?
Well, just because we think children can't have strokes doesn't mean that they do not have strokes. And just as an adult, a pediatric stroke is a medical emergency. So again, remembering the acronym of be fast. You know, is there sudden onset of feeling off balance? Is there dizziness? Is there lightheadedness? Is there maybe some clumsiness that is new? You know, are there vision problems? The E, sudden onset of vision problems, blurred vision, double vision. The face, you know, is there a droopiness in the face? Is there difficulty speaking? You know, is there a weakness? Is it one-sided for this little pediatric patient or this teenager? Is there difficulty speaking? You know, those are some of the things that as a parent you can look for. Also, you know, is there a new onset of seizure that is new for this pediatric patient, for this child? Those could all be signs that they are possibly having a stroke. And as I said, it is a medical emergency. So if you suspect a stroke, call 911, get the EMS, and have that child brought to the emergency department.
So I'm very glad that you've never seen a pediatric stroke, but how common are they?
Well, I've seen two in the last year at Community Regional Medical Center. And I'm just going to go to some of my statistics, if you don't mind, just because it is very interesting. So a stroke affects about 1 in 2,300 to 5,000 newborns. We're talking about newborn strokes as well. And so the neonatal period is from birth to the first month, and strokes can happen during that period as well. So the incidence of stroke in children is about 3 to 25 in 100,000, and the incidence tends to increase in young adulthood and is more prevalent in people over the age of 45. So those are some of the statistics for that. And then children who've had a stroke have a 20 to 40% chance of having a recurrent stroke. And also 50 to 85% of stroke survivors will have some long-term disability after a stroke. So strokes are not easily recognized because we don't think children can have a stroke. So there was the study that actually came out that said that a stroke was not diagnosed until about 22.7 hours after the stroke had happened. And as we know, strokes are emergencies, and the sooner we can diagnose a stroke, the sooner we can determine the best plan and treatment for this pediatric patient.
So you mentioned be fast there, and you mentioned some of the symptoms of strokes in children. Are they the same? Would they manifest the same as an adult? Would they look the same?
They could. And that's why it's very, very important as well that you talk to the parents, that when these children are brought in, that our providers talk to the parents and find out, is this normal for the child or not? Because there are things that can mimic a stroke as well. So we really need to determine, is this a stroke or is this something else that is presenting as a stroke? And that's why the history is very, very important. We have children that are at higher risk for having a stroke, but then again, stroke can affect anybody. So
what does put you at higher risk for having a stroke if you're a child?
If you have a cardiac abnormality, sometimes children have an infection that can put them at higher risk for having a stroke. 10% of children with sickle cell disease will also have a stroke. So those are some of the things that can put you at risk as well. Also, children with high blood pressure or hypertension, children who are obese have a higher risk, children children with diabetes are also at higher risk for having a stroke.
Okay, so it seems, I don't have any children, but it seems like a lot of information, and we want to be prepared, and I think if, the past few years has told us anything, is that we really want to be proactive about our health. So where can people go for more information about pediatric strokes?
So, Valley Children's, they do have a lot of resources as well. So there is information there. Talking to your pediatrician is also really important. Right. If your child has a neurologist, getting information from them as well. And then also California has 3 pediatric stroke centers. We have UCS Vanioff Children's Hospital, which is a stroke center. We also have Stanford Lucille Packard, which is a pediatric stroke center, and then Children's Hospital Los Angeles. Those are stroke designated facilities for pediatric patients. So those are some of the resources available if parents would like to know more. And of course, American Heart, American Stroke also have information on pediatric strokes.
Okay, great. This is all great information to arm ourselves with. Christelle, thank you so much for being here with us today.
Thank you for having me.